I'm really feeling blessed today that Dr. Indranil Bavdekar sir, who is a very senior most practitioner from Pune, has joined our session today. I'm really thankful to him and feeling blessed. So I will add some points of China that many of the patients will come to you with the report of peripheral blood smear. So what type of anemia you will see in China? What type of finding will be there on peripheral blood smear? If you want to give China and there is history of hemorrhages in patient from any of the orifice or any type of hemorrhage. पेशेंट आते हैं ना अपने पास ये लेके पेरिफेरल ब्लड से स्मेयर का रिपोर्ट लेकर आएंगे पेशेंट तो हमें अगर पेशेंट को हमें इसकी पता चल गई और हम लोग कंफ्यूज में है कि अभी ये पेरिफेरल ब्लड स्मेयर है और पेशेंट को और कोई अपने को दिख नहीं रहा है कि वेदर टू गिव चाइना और वेदर टू गिव पेरामेड इन विच केस यू आर गोइंग टू गिव चाइना Can anyone want to talk or should I continue? Okay. कोई बोलना चाहता है सर मलेरियल पैरासाइट फ्रॉम पिक्सल 7 नो सर पेरिफेरल ब्लड स्मीयर अनीमिया में करते हैं हेमाटोलॉजिस्ट और एमडी मेडिसिन यूजुअली एंड पेरिफेरल ब्लड स्मीयर या फिर कुछ लोग सीबीसी पे भी रिपोर्ट देते हैं माइक्रोस्कोप में देख के then the indication normocytic normochromic no madam so normocytic normochromic will we cannot label it as anemia aplastic anemia is different diagnosis Dr.
Sir, can I have a word?
Yes sir please.
Yeah, and normocytic normochromic anemia is there, and actually, sir, it is seen in all renal patients because there is no morphological defect in the RBCs, but they are all anemic.
Okay, so we can say where the hemoglobin levels maybe you can say above 8 8.5 10 in that cases you may be getting normocytic normochromic.
Yeah, all renal patients have normocytic normochromic anemia, and also another word for it is refractive anemia for that.
Okay, sir. Chalo. So I will. Okay, so I will give you the indication just after looking at the peripheral blood smear report. So there will be microcytic anemia with anisopoikilocytosis. If it is written in that report and history of bleeding, you can blindly give China without any second thought. That is what my experience. So I will ask you what is anisopoikilocytosis. I will just give 30 seconds. If someone wants, he can unmute and talk. Otherwise, I will move. On report, you can see.
Moon-like appearance of RBCs. Moon-like this thing of RBCs. Moon-like appearances of RBCs.
No, sir. That is sickle cell, na?
Oh, I got confused probably. Okay, sir. Yeah.
So, what is happening?
Can you repeat, sir? Repeat the condition.
Okay.
When this red blood cells has a different size and shape, we call it as an anisocyto.
Very perfect answer. Who is this?
Dr. Varsha, sir.
Very good, man. Very perfect answer. So, where there will be different size and shape of RBC are seen on the slide, then it is termed as anisopoikilocytosis. So, if the patient comes with such a slide and if you are not getting any totality, then I can bet on this remedy. You can directly start with this remedy. So, this is done about China. The next remedy we are studying is pyramid. So pyramid we have beware of delicate girls. So someone has very rightly mentioned over here that sensitive mentally and physically. Dr. Medha Kapoor. physically and mentally. Okay. Now we'll go to the page number 309 of Patak Mat Remedica. What will be the mind of pyramid to prescribe in anemia? So she is sensitive, excitable, then least contradiction aggravates her weeks and laughs immoderately. These are not the things with China. We are comparing both the remedies. Then anxiety as after committing a crime. So he will have that type of thing. Then under physicals, under head, you will read first line vertigo. When he will write suddenly, he will have vertigo. Generally, you will see this symptom in most of the cases of anemia. But here, when rising suddenly, it is marked. If you go to the nose, then bleeding in anemic patient. So here the anemia is not due to bleeding, but what Dr. Patak sir writes, bleeding in anemic patients, alternating with hemoptysis. So if you get to prescribe on such a keynote, you can go with this remedy. Then what will be the face? It will fail flushes or redness from least pain, emotions or exertion. After anxiety also you can see this pyramid patients may have this type of anxiety when coming to doctor. Then on page number 3110, if you go to stomach section, aversion to meat, then egg, sour fruits, to his accustomed tobacco, matlab jo hamesha leta tha beer. And then opposite to China, here there is desire for bread. In China, there was aversion to bread. Then desire for raw tomato, spits of food by mouthful. Then if you go to abdomen, then attempt to eat brings on diarrhea. So this remedy is again there in stools linteric or diarrhea linteric is the rubric or diarrhea eating after a rubric or there in pattern. I will give later. I will give you a tip in a group when to we see the many what we can say we see many babies who are passing stools after feeding. So there are two remedies. One is pyramid, they will pass immediately. Second remedy I will tell you afterwards. Then this patient will have palpitation which are aggravated by least motion. You can read on page number 311 under heart. The palpitation is relieved by walking slowly, then of masturbators and after loss of fluid. Then in extremities, if you read, when writing, hands tremble, but relieved when writing fast. So this is the all in all picture of pyramid, what you can see in cases of this anemia from bleeding. Now I will request you all after having this session, you go through the Soul of Remedies book written by Shankaran sir, and once read this pyramid, how pyramids evolved, the remedy gets evolved. Shankaran sir himself have proved this remedy on 12 of the provers. So I will just give you a theme. What is theme written by Shankaran sir in his book. So you can collaborate this mental picture to the physical, to the diagnosis, and then prescribe. Then you will get good results. So so what is theorem? Theorem is the iron. So what the things we made from iron usually? The gate, the shield. So the things which can protect us, right? Yeah. So to protect us, those things are made from the iron. And then Shankaran sir writes over there that two of the provers of them got a dream that the marriage against their will has been in their dream. So in pyramid there will be a continuous theme in background that they are compelled to do something against their wish. So you can consider a situation of parents force to get admission for MBBS course or BHMS or engineering or IIT, because what we have learned over here that it is suitable remedy to the adolescents, no, right? So parents will force the children will fight against the parents, and then they will go to the obstinacy. Then they are having the guilt within them that they are not obeying parents. Then this will continue, and they are they will behave like iron, which cannot be bent easily. So this is the theme of what we can say in pyramid. It's very beautifully written in Soul of Remedies by sir. I will request you to go through that. Then Ferrum always have to defend and protect themselves and their families. What example I have given you in phosphoric acid, that they are trying hard against the what we can say the situations which are not in their favor. Still they are trying, and they got disappointment from not appreciating. So here also Ferrum will work for the family. They will not allow anyone to enter into their territory. You can imagine that there is a door made up of iron, and why we are putting that door over there? Because we are not allowing anyone to any unknown person to enter in our territory. So the pyramids patients have their own territory. If someone tries to enter in their territory, then they will rebel, or then they will show their reactions. So the rebel that will lead them to dreams of battles and fights and wars. Okay, so this is about the second remedy, pyramid. Then we'll proceed to the next subrubric, which is anemia pernicious. So is it clear up to this?
Yes, sir.
Okay. So the next rubric
sir.
is anemia pernicious. So let me know what is pernicious anemia.
Where the RBC could go reduce.
Okay. What more?
Anemia due to deficiency of vitamin B12.
Very good, sir.
Vitamin B12.
Yes, very good. So what happens in pernicious anemia? There is decrease in RBC when body cannot absorb enough of vitamin B12. Okay. So lack of vitamin B12 will lead the patient to, we are talking about the normal symptom of pernicious anemia here. It will lead to fatigue, then weight loss, then it will have tachycardia, then dyspnea, then dizziness. And what type of reports you will get to confirm B12 deficiency anemia or pernicious anemia? How you will come to the diagnosis? How will you arrive to the diagnosis? So first you will have to do hemoglobin, right? It will be on lower side. Second, you need to go for B12. It will be on lesser side. Then what more? So you see some patients are having icterus along with anemia. Yes or no?
Yes.
So bilirubin will be increased in such a
Yes.
cases. And on peripheral smear, if you do, then there will be macrocytosis. We have seen microcytosis in China, but in pernicious anemia, you will see macrocytosis, right? Then homocysteine levels will be increased, and one more factor is there, intrinsic factor. So intrinsic factor needs to get checked. I think these are tests done by hematologist. Patient may come to you with these reports, and they may ask to you. If intrinsic factor is on very much lower side, then these patients, kindly, I will advise you to ask them to take allopathy for some time, because it may be life-threatening condition, and this intrinsic factor will get increased. Then they can be survived of those life. Now, my next question is that which are the allopathic medicines patient is on long-term treatment, and after taking that medicines, he may have B12 deficiency. You should know the root cause also, na? Yeah. Right.
Diabetic medicines.
Which type of
Anti-diabetic.
diabetic medicines? You are right, diabetic medicine, but which anti-diabetic or hypoglycemic medicine which cause?
I think metformin.
Very good, sir. First is metformin. तो एंटी डायबिटिक में मेटफॉर्मिन की पेशेंट रहेगा तो he will have pernicious anemia. What more medicines other than anti-diabetics?
Tuberculosis.
Tubercular, okay, sir, maybe, but I don't know whether tubercular medicines follow. But we are talking about common medicines. जैसे भी सर ने डायबिटीज बोल दिया वैसे एलोपैथी में आए दिन हर पेशेंट में ज्यादातर लोग क्या देते हैं?
Thyroid patients also.
नहीं मैडम, आप इन्हें एकदम आसान आसान सोचिए.
Sir, patients taking proton pump
Vitamin
inhibitor
B12
for
deficiency.
PPI tablets.
PPI,
Very
PPI,
good,
yeah.
very good, very good, very good. So this proton pump inhibitor ये अगर शुरू रहेगा तो पेशेंट को ये हो सकता है. तो पीपीआई जैसे रहते हैं सेम इज H2 receptor blockers, H2 blockers like ranitidine, famotidine. So if your patient is on those medicine, he is coming with this one, then you have to ask them to change those medicines from the treating doctor of allopathy, and you can treat their anemia or
Sorry, last second cause, second medicine.
proton pump inhibitor like omeprazole, lansoprazole, rabeprazole, pantoprazole, esomeprazole, like that. And second is ranitidine, famotidine. Other I don't know the tidines now. So the first remedy written over here is arsenic. Can you please open page number 82 from Patak Matre Medica?
Sorry, page, sir.
82. So Patak sir writes, blood is disorganized causing pernicious anemia. So you got that line?
Yes, sir.
It is fifth line. Okay. And severe septic condition. So disorganized blood will cause pernicious anemia and severe septic condition. Then what will be the type of hemorrhages? They will be black and offensive. What will be the outcome due to this anemia? So patient will have weakness. He will have the history of rapid emaciation. Then he will have prostration. Seems to be out of proportion. The third last line under generality. Then on page number 83, if you see seventh or eighth line, then low vitality will be there. So gradual loss of weight will be there. Then if you directly go to page number 85, then you can see under mouth, fourth last line, apathy in mouth. So we have seen this history of apathy in which remedy?
Natramur.
Very good. Then if you move to abdomen on page number 86, the first line, induration and enlargement of spleen and liver. So you will expect hepatosplenomegaly over here also. So moderate to severe anemia you can expect in such a cases. Then under below abdomen there is urinary, and if you read the second last line under urinary, retention of urine as if the bladder were paralyzed after parturition. So you will open page number 37 from Patak repertory and please see the rubric for this sentence. This is away from our topic. Page number 37. And read out the rubric. What rubric I want to get your attention. पेज नंबर 37 पे रुब्रिक देखना. ये सेंटेंस के लिए रिटेंशन ऑफ यूरिन एज इफ द ब्लैडर वेयर पैरालाइज्ड आफ्टर पर्फ्यूरिन.
Bladder weakness, parturition after.
ब्लैडर वीकनेस नहीं. एग्जैक्ट रुब्रिक देखो इसके लिए.
Bladder paralysis. Parturition.
वेरी गुड. सो रेमेडी कितनी है वहां पे?
दो.
दो मेडी.
आर्सेनिक एंड
Arsenic और
फॉस्फोरस.
phosphorus.
और फाटक सर कितने कंजूस है, ये लाइन को एक रूब्रिक में कन्वर्ट कर दिया, लेकिन यहाँ पे सिंपल सिंपल फॉन्ट में लिखा है, ना आपको ना ही उसको कैपिटल किया ना रोमन में डाला, राइट? Okay, so next you will move. What will be the consequences of anemia in cases of arsenic? You will read out the first line under respiratory. Patient will have shortness of breath. He will unable to lie down. Then under heart, he will have palpitation with anguish. Pulse will be more rapid in morning. Then he will have palpitation with tremulous weakness after stool. It is written under heart. So this is all about arsenic under what we can say anemia. You can combine something that arsenic has unquenchable thirst. He drinks little and often. He craves ice cold water, but it gets immediately vomited. Then the characteristic of arsenic you can add for the totality, and then you can form a totality to prescribe arsenic in cases of pernicious anemia. Then the next remedy over there is phosphorus. So page number 550. So first line, phosphorus causes inflammation, degeneration of mucous membrane of stomach and bowel, inflames the spinal cord and not causing paralysis. Then the fourth line, disorganizes the blood, causing fatty degeneration of the blood vessel. Right? So fatty degeneration of blood vessels को हम लोग आज के डेट में क्या टर्मिनोलॉजी से जानते हैं?
Atherosclerosis.
Very good.
Atherosclerosis.
Very good. Then gradually increasing debility is here in phosphorus, ending in severe or rapid disease. Hemorrhage is recurrent, vicarious, small wounds bleed much. This is under generality. If you see the second line of page number 551 of phosphorus, you can read out polyp, easily bleeding, jaundice as a concomitant. So what I was talking about the investigation part of pernicious anemia. I already talked that bilirubin levels will be marginally raised in cases of pernicious anemia, along with in anemia only. Then Sir writes jaundice as a concomitant, hematogenous, then hemophilia, it is also one of the indicated remedy over here. Then polycythemia. What is polycythemia?
Increase RBC.
ओके, इंक्रीज आरबीसी. ओके, तो ऐसे पेशेंट में 17, 18, 19, 20 ऐसा हेमोग्लोबिन होता है, एंड दे में लीड ब्लड लेटिंग और ब्लड डोनेशन, ब्लड निकालना पड़ता है इसी केसेस में. सो इट इज वन ऑफ द इम्पोर्टेंट रेमेडी फॉर दोस थिंग्स आल्सो. Then on page number 552, if you read under head, then Pataksa write the first line, vertigo accompanies many symptoms. So whether it is anemia or it is anything, there will be vertigo. So vertigo will be concomitant when to prescribe phosphorus. Then what will be the face on page number 553? If you go and read the first line, pale about nose and mouth. तो नोज एंड माउथ जो है ना यहाँ पे फेल होता है. यू विल सी दिस टाइप ऑफ फेस मैक्सिमम इन पीडियाट्रिक केसेस. दैट इज व्हाट माय एक्सपीरियंस इज देयर. Then if you go on page number 555 under heart, violent palpitation with anxiety for least thing, from least thing. So anemia will cause this thing. Then under extremities, ascending sensory and motor paralysis from end of fingers, and so this is very last thing. And then if you read the most important thing under phosphorus, then you will go in the sleep chapter and read about the dreams. Someone please read. This is a very peculiar thing you will get.
dreams of fire, fluid dreams of hemorrhage, and feels in the morning as if he has not slept enough.
So what is the important dream for us, which is related to our
Fluid and
current?
fire. Yes.
Fluid dreams.
The fire.
Of memory.
How many of you were knowing dreams of bleeding before this session?
No, sir, not aware of phosphorus having such kind of dreams. Not at
Okay,
all.
I was also not aware of this thing, but while preparing for this session, I have gone through that and I got that. So this is all about phosphorus. So how much time we are having now? I don't should I take the next rubric anchors, or I should go with biochemic application in anemia? What do you suggest?
Biochemic.
Biochemic.
Biochemic. Biochemic.
ओके चलो फिर आना हम लोग बायोकेमिक मतलब अनीमिया आज खत्म हो जाएगा. सो आई हैव ग्रुप पे हमने पोल डाला था. पोल में पूछा था कि व्हाट विल बी द फर्स्ट व्हाट रेमेडी यू विल थिंक इन बायोकेमिक टू गिव. तो बहुत सारे लोगों का आंसर था फेरम पॉस. आपका आंसर पूरी तरह गलत था ये मैं नहीं बोलूंगा, क्योंकि डॉक्टर सुजलर भी पहले फेरम पॉस दिया करते थे, लेकिन बाद में जब उन्होंने
Antremur.
एक्सपीरियंस किया तो एक्सपीरियंस होने के बाद में उनको समझ में आया कि गिविंग थेरमपॉस एज फर्स्ट लाइन ट्रीटमेंट इन केसेस ऑफ अनीमिया वाज ही वाज डूइंग रॉन्ग. देन मतलब ये उनके बुक में ही लिखा है, विच इज रिटन बाय डॉक्टर बोरिक एंड दिवे. सो calcarea phos is the first remedy to be start in cases of anemia. I usually advise to start with this remedy in moderate to severe cases of anemia. You should not consider this remedy as a first line treatment when patient is having 9 or 9.5, 10 or more than that hemoglobin. I will also want to caution you that we have 3x, 6x, 12x, then 30x, 100x, 50x, and 200x potencies of biochemic medicine available in market. So higher potencies, if you are treating anemia with biochemic, you need to give higher potencies like 100x, 50x, or 150x in cases of old age person. So this is first thing. And routinely you can go with calcarea for 6x, routinely what we can say in adults or in pediatric. So if higher potencies are given for more time, say what are the higher and what are the lower? So lower potencies biochemic are 1x, 2x, 3x. So more than 3x, all the potencies are termed as higher potency. So if you are giving calcarea phos for prolonged period, then it may cause renal coli and formation of calculi and passing of calculi. So be cautious. I will advise not to repeat calcarea phos any of your case more than 3 months. This is what my experience. But 3 months is my experience. But this can cause renal colic and formation of stone. It is written by Schussler only. Okay, so what will be the action of calcarea phos? It will act by supplying new blood cells. Schussler was giving this remedy in anemia cases. Many of the cases he didn't require to go with serum phos or any other remedy. After that, many of the cases of Schussler were solved with calcarea phos alone. In which type of cases you will consider? Then those cases are of nutritional anemia, which are leading to cerebral signs and symptoms. Which type of cerebral signs and symptoms? So patient will have headache, dizziness, sleep disorder. He may get sleeplessness or on and off sleepy or sleeplessness, alternating with each other. Then he will have body fatigue. Then lack of memory, weakness of memory. You can give in B12 deficiency anemia, what we called as pernicious anemia. Then what will be the type of hemorrhage over here? So patient will have bright red or dark clotted hemorrhage over here. Patient will have phosphorus like palpitation and anxiety, trembling and weakness. Especially the trembling and weakness will be there in calves. So greatest weakness will be there in calcarea phos patients. The patient will have defective nutrition, Then you can think calcarea cause in anemia of babies or children with dentition problem or having open fontanelle for a long time. Then growing age children or adolescent age, what we talked about. Then in old age, then patients having history of bone pains, then impaired memory, then anxiety. Then they will have mental fear. They will have slow comprehension. The children may be peevish. They may be irritable. Uh, so in such a situations, you can consider calcarea cause. Now, Sudhir advises us to give ferrum phos after calcarea phos. So what calcarea phos has done? Calcarea phos has increased the supply of new blood cells, right? Now, what will be the ferrum phos will do? Once general health of patient is improved, you can shift the patient to ferrum phos after calcarea phos. So calcarea phos will supply new blood cells, and ferrum phos will attract oxygen. It has the capacity. Ferrum phos has the capacity to attract the oxygen. He will take in the oxygen. He will return the cells. RBCs more so that they can carry more oxygen. So this is the work of ferrum phos over there. Then what will be the mental status? If you need to start the case with ferrum phos first, not the calcarea phos. Then these patients will have indifference to their domestic or routine work. Then they will have hopelessness as a mental picture. Then they are what we can say, they are relieved by sleeping. Then you will see the dark circles around eyes. We have seen one remedy of blue circles around eyes. In ferrum phos cases, you have dark circles around eyes. Then the face will be flushed as we talk in ferrum met. Uh, then operation and dyspnea will be there as a physical symptom. So this is all about ferrum phos. Then the next remedy comes among biochemical Kali phos. So Kali phos will have the cerebral anemia symptom as we talked in calcarea phos. They will have what we say ailments from the prolonged depression or prolonged worry. Then anemia from spinal disorder. Patient is having some spinal chronic disorders leading to prostration of mind, nerves, and muscles. Then they will have brain fat in what we see in studying age group. Uh, they may be overburdened by the work or overburdened by study. Then they will have loss of memory. Then the students may omit or they may write the wrong word instead of the right words while writing. Patients of school age group or college age group will have headache, and that headache will be relieved by eating. And Kali phos patients will have more thirst and more hunger. The physical concomitant over here will be palpitation, but that is a common symptom of this disease. You will get palpitation in almost all the remedies of anemia. Then the next remedy comes is natrum. So natrum will have habitual feeling of coldness in back. It is indicated especially in young girls. What we talk.
Sir, sorry to interrupt you. In this Kali phos case, in case it is an adult of 40 years old female with thyroid, can it be given for like this wrong words and brain fag? I just remembered one of my patients.
Yes, madam, you can
Uh,
think surely.
yeah, no, means, okay, okay. Thank you, thank you.
So, natramur usually indicated in young girls, so they will have again palpitation and symptoms in case like anxiety. Then, what we see in natramur, we are talking here about biochemic, not about the homeopathic, right? So, don't mix up the picture of homeopathic natramur and biochemic natramur. They may be different. There are some similarities, but not the exact similarities between the both. So natramyl will get easily 40 gram prostrated. You can have that characteristics tongue or a clean tongue. It may be there in under biochemic. There is not mention about those characteristics. What we see map tongue over there. Grip will be there for sure. Then this natramyl patient will have constipation. Then they may have history to have got undergone treatment for fever with chills, what Dr. Shuzla writes over there, that they may have taken some treatment for malaria, ague fever, they write over there. Then this patient will have emaciation, that nattermore personality you always know. Dwells on past agreeable event. This is a symptom in biochemical. So then weeping tendency will be there. Headache will be aggravated in morning for nattermore cases. Then they are so much tired that they will always have desire to sleep and lie down. So excessive desire to sleep is the keynote symptom to go with natrum in cases of anemia. Next remedy is natrum pause. They will have what we say paralytic weakness of the limb. They may be upper limbs or lower limbs. The lady or the person cannot work due to anemia. What work she or he was doing before. So prostration and fatigue will be marked, and this prostration will be aggravated just within a short walk or ascending. If they are taking some steps, they need to stop over there. Then leg will get their way. पैर एकदम से थक जाएंगे, they will need to stop, and they will then they can walk again, and they need again to stop. So they cannot be unable to progress further or move further. Then to prescribe natrum pause, you may get the history of gout or arthritis along with anemia. So natrum pause is indicated in such cases also. Then the patient is anxious, and he will have apprehensive fever, fear that something would happen to him or with him. Then the last remedy under this biochemical natrum sulf. So natrum sulf is as all you know that this is the hydrogenated constitution remedy. What we say the psychotic remedy. They are getting aggravation in damp weather, or the persons who are living in such areas uh, having swelling due to anemia or any other reason. Anywhere on the body or all over the body due to anemia or for due to any other reason, then you can think of natrum sulf. Natrum sulf cases will get aggravated for any of the complaints regarding biochemic medicines is aggravation on lying on left side. So this is all from my side regarding anemia in biochemic medicines in anemia, indications and contraindications.
Dr. Bagal, good evening to you.
One more thing I forgot to tell you, the important thing. Whenever you need to give serum pause as the first line treatment or the follow-up after calcarea pause, always remember not to give the doses at night time. Why? I don't know. Dr. Borik and Dive book says that thing. So we need to follow. If you are giving, you can observe the patient whether they are getting constipation or getting some sort of cardiac anxiety or chest anxiety. I don't have given at night time. Before that time, I was also prescribing this medicine at night time also. But after knowing, I stopped prescribing at night time, so I am giving daytime also. That is precaution only to be taken from serum pause. Please, sir, go ahead. This is from my side.
Yes, thank you.
We
Good
are not
evening.
going to join again.
Okay.
1 minute is left only.
So I will be very fast. There are two questions. First important question is a boy of 8 years old came down to 8 of this hemoglobin, very weak, and especially weak, afraid to go to the school also, that the other children are bullying him, teasing him very much. So to increase this thing that I'm coming back to calcarea force and this ferrum force, how we can add these two remedies of biochemic to